Hello, good morning, everyone. Welcome to this webinar. We're going to start in a little bit. I'm just going to give a few minutes for people to start joining us. So welcome, and thank you for being here with us today. Hello and welcome, everyone. You can see people joining. We're just going to wait a few more seconds. All right. Okay, so good morning, everyone. Welcome to this webinar, and thank you for joining us here today. For those of you who do not know me, and I say that because I can see that we have our Caribbean youth who attended the first Caribbean Youth Forum on Drug Use Prevention last year in Barbados. But I can also see that we have other youth from many countries and other parts of the world. I can see also that we have here some of the professionals that work in the National Drug Councils. Welcome, everybody. My name is Isabella Araujo, and I am a member of the Demand Reduction Unit team at the Inter-America Drug Abuse Control Commission at the Organization of American States, the OAS. It is a great pleasure to be with you all here today to discuss a relevant topic for the youth, especially during these challenging times, which is how to support mental health, strengthen our coping mechanisms, and avoid substance abuse during the pandemic. As part of our agenda today, in our opening ceremony, we will welcome Ms. Nathalie Panabokke, Acting Director of the Colombo Plan Drug Advisory Program, Ms. Charlotte Sisson, Foreign Senior Officer of the Bureau of International Narcotics and Law Enforcement Affairs of the United States Department of State, Ambassador Namm, our Executive Secretary of CICAD OAS, and our very special guest, our Assistant Secretary General of the Organization of American States, Ambassador Nestor Mendez. So after our opening ceremony, we will welcome Dr. Wendel Abel, Professor of Psychiatry and Head of the Faculty of Medical Sciences at the University of West Indies, Mona in Jamaica, to start his presentation. I want to let you know that this will be an interactive session. So for the first 10 minutes of Dr. Abel's presentation, you can raise your hand when you wish to speak or respond to the questions posed, and we will give you access to use your microphone and or your camera in an orderly fashion. At the end of the presentation, we will have a Q&A session, so you will be able to share your thoughts with us and ask any questions that you may have. And also, please feel free to provide any feedback. To do that, you can either use your microphone, or if you're shy, you can just use the comment box in the bottom of your screen to type in your questions, your comments, and your feedback. And in the very end of our session today, we will have our Demand Reduction Unit Chief of CICAD, Ms. Jimena Kalawski, delivering some closing remarks. I want to thank you again for joining us here today. It's so good to see you all. And I truly hope that you enjoy and that you actively participate in this session. So as we're about to start, I would like to invite now Ms. Nathalie Panabokke, Acting Director of the Colombo Plan Drug Advisory Program, to deliver her opening remarks. Ms. Panabokke, you have the floor. Welcome.
Thank you, Isabella. I'm Nathalie Panabokke, Acting Director for the Drug Advisory Program of the Colombo Plan. I'm a clinical psychologist by profession, so the topic of this webinar is of particular interest to me, especially since this year, 2020, keeps throwing punches at us. The global lockdown brought about by the coronavirus has made it very challenging for us all. The uncertainty about the situation and the simple fact that we couldn't or shouldn't go out has brought about a rise in the incidence of mood disorders such as anxiety. These difficulties are only exacerbated amongst those struggling with substance use disorders. not only are they at the risk of COVID-19, but they're also at the risk of relapse, and in some cases have reduced resources by which to protect themselves. It is so very important to ensure that they have continued access to treatment and support services, not just to protect their health, but also to make them feel safe and secure. There's been an immediate jump to moving all our work online. DAP has been providing technical assistance and training through Zoom sessions and Teams meetings, and even conducting monitoring visits to treatment centers online. This way, we could help ensure that treatment services remained active so that health, safety, and well-being of this special population is maintained. In that sense, resilience was important to us too. We needed to make sure we could overcome the challenges we were facing and help those who were actively helping those with substance use disorders maintain their recovery and foster their own resilience. One thing that has come out of these difficult months is the increased collaboration between the various agencies working in this field. DAP has always worked very closely with US-CICAD on a number of initiatives, such as developing curricula for online dissemination, the development of a specialized curriculum for youth, and conducting webinars such as these. I'd like to take the opportunity to thank CICAD for inviting us to collaborate with them on this, and we're greatly appreciative of these efforts as we're continuing our treatment and prevention initiatives. And it is our pleasure to be here today to discuss this very important topic. Thank you.
Thank you very much, Natalie. I would like to invite now Ms. Charlotte Sisson, Foreign Senior Officer of the Bureau of International Narcotics and Law Enforcement Affairs of the United States Department of State, to deliver her opening remarks. Welcome, Charlotte. You have the floor.
Good morning, everyone. I want to thank the Organization of American States for organizing this webinar this morning and for their work in prevention. I also want to thank the Colombo Plan for their work and to recognize the great collaboration that the Organization of American States and the Colombo Plan have worked on together to create a youth forum, a curriculum over the last year and a half or so. I think it's a great collaboration, and I hope to see it continue. I also want to recognize and thank Dr. Wendel Abel for his time this morning to talk about youth mental health and substance use, as well as tools that can be used to help youth in communities. I also want to especially thank all of you on the webinar this morning for taking out time in your day, wherever you are in the world. You're the forefront of leading people and young people, and I commend you all for the energy and the passion that you have into supporting your communities. During the limitations and the difficult times of COVID this year, and I know everyone has their own unique special circumstances, I know that a lot of you are still working very hard to prevent substance use disorders in your communities. I'm really looking forward to Dr. Abel's presentation. I think that through the interactive session that they're planning, I think that we'll all find some inspiration and maybe some ideas too that will help you as you continue your work. My office, the International Narcotics and Law Enforcement Division, and especially drug demand reduction where I work, really is to build the capacity of prevention, treatment, and recovery professionals worldwide. And I know I spoke to some of the Go Forth reunion leaders last week from Asia, Africa, and other places in the world. A lot of them I was truly impressed with that have gone on since 2014 to start their own organizations to provide skills-based training in their communities to much, much more. So I want to say, if anyone's on the line from last week, hello again to you. I also want to say hello to the Caribbean youth leaders that I was able to meet last year. I know that I was also able to travel to some of your countries and see some of the, hear about some of the prevention work that you're working on. So hopefully after we're done with COVID, I can come and visit some more of your countries and see what kind of work that you're doing. I know that everyone has been working hard in the Caribbean youth for the last year and a half. We have year-long projects I want to thank you for that. During COVID, my office has not stopped working at all. We actually have been, like Natalie from Colombo Plan has mentioned, really trying to move things to an online platform. We're working on a new self-guided course so that if you log on, you can take some treatment courses. That'll be slower to start, but eventually we'll be able to do more of those. But we are piloting new courses online. We have a basic counseling skills course that we're piloting that's almost ready, and as well as a recovery course. And much of the curriculum for prevention. So if you want to learn more about prevention and how that might be helpful for you, that's all online on the ISIP website. And the ISIP website is the International Society of Substance Use Professionals, which can be found at www.issup.net. And on there, you can also access courses, establish networks, join forums, and now there really are a lot more recorded webinars to watch related to the field of substance use disorders. And I know to include this one that will also be posted. So even after we're done with these limiting conditions, I think we're going to still have all of these new ways to communicate online. So it's kind of a silver lining that we're still trying to promote, really helping those in the field of substance use prevention, treatment, and recovery. And I want to thank again all of you for on the phone, and especially to the international organizations that are helping to promote this. And thank you again, Dr. Abel, for your time.
Thank you very much, Charlotte, for your remarks. I would like to invite now Ambassador Adam Namm, our Executive Secretary of CICAD OAS. Ambassador.
Thank you, Isabella. Good morning, everybody. I should say good morning again to the Caribbean youth leaders and youth participants, because of course we saw each other in Barbados last year. Seems like a long time ago. A lot has happened since. Also want to welcome youth from around the world, all of you who are watching us today. It's a great pleasure for me to be with you this morning for this webinar, which is going to address an important topic, a very important topic affecting many adult and youth populations around the world: mental health and substance use in the context of the COVID-19 pandemic. Last year in Barbados, at the first Youth Forum on Drug Use Prevention, you learned a lot about the science of prevention and also developed promising projects to implement in your communities. None of us could have then predicted how this pandemic would change the world, and also what challenges the pandemic would pose. And just as none of us could have predicted the pandemic, none of us can say with certainty when it will abate. It has inflicted severe economic and social hardships on all countries, as well as health hardships, and has also taken a great toll on mental health. We recognize that substance abuse and mental health disorders, such as depression and anxiety, are closely linked, and that substance use can cause prolonged psychotic reactions. In the context of the pandemic and the social isolation it has imposed on many of us, most of us, the feelings of fear, anxiety, and stress are common and absolutely normal emotional states. However, while we experience various types of emotional distress, we need to have strong coping mechanisms to respond appropriately, to respond in a healthy way. Youth and young children are even more vulnerable and therefore need special attention. The presence or absence of various combinations of protective and risk factors contribute to the mental health of youth. And there is much we can do to promote positive mental health and prevent or minimize mental health problems. In that regard, the goal of today's webinar is to provide all of you with practical tools for recognizing feelings, dealing with emotions, and staying strong as we go through these challenging times. We're going through these challenging times together. We hope that you'll benefit from the webinar and that you'll also become equipped with the tools to help your peers in your communities. It's a tremendous honor to have with us a distinguished group of speakers whom I want to recognize. The Organization of American States Assistant Secretary General, Ambassador Nestor Mendez. I'm so pleased, sir, that you're able to be with us. Ambassador Méndez hails from Belize, so knows well the challenges facing Caribbean countries. Charlotte Sisson, who just spoke, from the U.S. Department of State's Bureau of International Narcotics and Law Enforcement. As always, we couldn't do this work without the support of our donors. I'm so grateful to the U.S. government for its strong, very strong support of CICAD. Nathalie Panabokke, who spoke earlier, the acting director of the Colombo plan. I want to thank Natalie and her team for their invaluable support to the Youth Forum project. And Dr. Wendel Abel, psychiatrist, professor, and head of the medical sciences faculty at the University of the West Indies, Mona campus, for sharing his expertise and leading the presentation today. Thank you very much. I hope you get a tremendous amount out of today's webinar. I hope all of you out there, your families and your colleagues are in good health. Thank you again.
Thank you very much, Ambassador Namm. I would like to invite now our Assistant Secretary General of the Organization of American States, Ambassador Nestor Mendez. Ambassador, welcome. You have the floor.
Good morning, everyone. It's always a pleasure to join the youth of the Caribbean. As Ambassador Namm said, I am from Belize. And so every opportunity to engage with the leaders of this region, which is really my family, is always very special for me. I would like to start by recognizing Ambassador Namm, Executive Secretary of CICAD, the Inter-American Drug Abuse Control Commission, and a good friend. It's good to see you, Ambassador. I hope you're keeping well. Would also like to recognize Ms. Charlotte Sisson from the U.S. State Department, Ms. Nathalie Panabokke, Acting Director of the Colombo Plan, Dr. Wendel Abel, Professor of Psychiatry of UE, and all the distinguished panelists, and especially a very warm welcome to our Caribbean youth leaders. I'm honored to participate in this morning's webinar along with our Caribbean youth leaders during these unprecedented and challenging times. I welcome back those of you who participated in last year's Caribbean Youth Forum, and I thank you for joining us for what I know will be an informative presentation by Dr. Abel. Since 2019, under the leadership of the Inter-American Drug Abuse Control Commission and with the support of the Colombo Plan, participants in this program have worked tirelessly to make a difference in their communities by supporting their peers and strengthening their abilities to continue the fight against substance abuse. More than ever, this fight is extremely important and present today. Every country in the world is currently facing the severe challenges presented by COVID-19. However, the impact of these challenges are often magnified in the Caribbean, where our countries have limited resources, which ultimately impact their resilience. These challenges highlight the critical importance of the work being done by CICAD in the Caribbean region. It is undeniable that the economic and social crisis generated by COVID-19 has upended our world, further exacerbated existing challenges in the region, such as substance abuse. We at the OAS recognize that the world drug problem constitutes a global challenge that negatively affects the public health, security, and well-being of all our citizens, and especially our youth. We are particularly cognizant of the fact that the drug problem disproportionately affects youth and as a consequence endangers the future of our nations. Recognizing the relationship between mental health and substance abuse and the challenges this global pandemic has presented, we must work diligently to address the increased risk of substance abuse. It has become evident that the pandemic will have long-term economic consequences. But what we do not know as yet is the long-term mental effects our communities may be left to deal with. This makes addressing the drug problem in the Caribbean through a united and coordinated strategy all the more important. As evidenced by their drug prevention initiatives, Caribbean youth are working diligently to make an impact in their communities by helping their peers, especially those with a higher risk, to learn and to strengthen their life skills, to encourage and uncover their talents, while also helping them to develop coping strategies for preventing drug use. The excellent work the Youth Forum participants are executing in their communities is particularly significant because it represents a grassroots peer effort approach to counter the scourge of drug dependence. I take this opportunity to congratulate your leadership, your motivation, and willingness to be the force and the voice of change in your countries. My dear young leaders, you are the embodiment of innovation and progressive ideas. You are the pioneers and implementers. Your nations, all of us, are counting on you, and we are here to help you along the way. I look forward to joining you in future discussions to hear how your projects are progressing. I wish you a productive, purposeful, and enriching discussion. And I would like to end by once again echoing the words of Ambassador Adam Namm, expressing a heartfelt thank you to the donors, without whose support all of these invaluable work could not take place. We know that more than ever, the economic crisis that will follow the pandemic may impose certain constraints on all of us. But remember, these are very important programs that cannot be sacrificed when we start to make decisions about funding. Please, what you are contributing is very important, and we thank you for it. Thank you.
Thank you very much, Ambassador Nestor Mendez, for joining us here today and for your remarks. I would like to now invite Dr. Abel to start his presentation. Dr. Abel, you have the floor. Welcome.
Good morning, everyone. It's a great pleasure joining you all on this webinar today. The World Health Organization, as you know, declared the COVID-19 a global pandemic in March of this year. And since that declaration, we've seen significant disruption in our lives, dislocation. It has caused distress to many individuals and communities. And this morning, we thought that it would be important for us to speak to you all as young people and as young leaders within your community. And so my presentation is really intended to be more conversation, discussion. And we're doing this because we value you, we trust you, we need you, as you are our future. And so it's my greatest pleasure to have been invited to present on this webinar. And I really thank the OAS for extending to me this invitation. I also acknowledge the presence of my fellow panelists who all shared with us this morning. And there are others who will be joining us later. But the context, of course, is that with the onset of the COVID epidemic and the challenges we have faced, it certainly has put many individuals, young and old alike, for increased risk for emotional problems and mental health issues and substance or problematic substance use related issues. And this conversation, what we intend to do is to explore coping mechanisms that we have been using, because as young people, I know we can learn a lot from you. We want to listen to you and hear some of the exciting things that you have been doing to cope. And in the process, it's my intention to add to the discussion by sharing with you a number of tips, coping mechanisms. And so we're now, we've moved along. I mean, it was the start of the pandemic. Then in many communities, experienced lockdown, borders being closed. And in many communities, we are beginning to adjust to the new normal. And as part of that new normal, many communities are reopening, countries are opening their borders. And so with the passage of time, we would have gone through, experienced different impact of the COVID crisis. And I want to hear from you as young people, how are you coping? This is a question I'm actually throwing out to you. We want to keep the energy in the webinar going, so we want you to participate and share in, right, to make it a very worthwhile discussion. So the floor is now open, and I want to hear from you. How are you coping? How have you been coping?
So if anyone wants to respond, so please, you can raise your hand so we can turn on your microphone. And I also want to take this opportunity to ask Dr. Abel, if you can please speak a little bit closer to the microphone, because it's the sound is changing. So when you, when you speak a little bit closer here, thank you.
Is that better now?
Yes, yes.
Okay, thanks.
Thank you.
Hello, good morning.
Hi, morning.
Good day. Dwayne Jackson from Sisson here. Just to share about how I've been going through this COVID pandemic. I mainly channeled a lot of energies into creating an exercise program for persons who are on lockdown during the entire COVID period, so that you have an avenue to release yourself mentally, develop a good physique, and lose weight that you might have gained throughout the lockdown periods of eating, for sleeping too much, etc., etc. So that's what I have been doing to cope with the pandemic. I just launched a program that I would send to young people, young adults, even seniors, to keep the body going, keep the mind active, you increase your metabolism, you change your diet around, so you could just, after you come out of this pandemic, you'll be, say, a brand new holistic developed person.
Okay, Dwayne, thanks for sharing that with us, and let me congratulate you for an excellent effort. But let me turn the spotlight on you a little bit. How have you been doing personally as an individual? How has it affected you, and what other techniques have you used to deal with yourself as an individual?
For me, individually, it was rough at first, in terms of everything happened so abruptly, and we went on being locked up in the house for 7 days straight, and see no one in person. So for me, I'm an outgoing person, and I can be an extrovert. So that changing so drastically, it caused a bit of anxiety and the putting yourself in a low position in terms of your mental space. So what I try to do, I get in contact with a lot of my friends overseas, locally, created different fun activities that we did online, so that to help me to come out of that was in terms of, you know, being an extrovert and then having it cut off from you instantly.
Okay, well, again, thanks for sharing. So I hear in your response, you said it was rough at first because everything was happening abruptly. And you mentioned that you had feelings of anxiety. And then you shared with us the fact that you were able to, with other young people, engage in online fun activities. Congrats. Thanks a lot for sharing. And I'd like to hear from other young persons on the webinar. So the floor is open.
Hello.
Hi, how are you doing?
I'm doing great, sir. Thank you so much for this opportunity to be a part of this wonderful webinar. I would like to share one, positive side of COVID.
What's your name, please?
My
Could
name
you
is
share?
Abhimanyu.
Yeah.
My name is
Yes.
Abhimanyu Singh Tomar, and I'm from India. And I would like to throw some light on the positive side of Corona, the COVID times, where in India, the youth is getting more time to spend with their parents. And somewhere the gap which was there, it is filling, and they are engaging themselves with their family members. And somewhere it is taking them away from the substance abuse and all sorts of things. So it's a good part, sir.
So what you're telling us is that, well, thanks for sharing that with us. And what you're saying to us in that your experience in India is that it allowed you a great opportunity to spend time with your family and to interact with your family. Well, thanks. And you know, it's certainly an important positive. But I'd like to hear from you in terms of your own personal response. How did it impact on you initially?
So basically, if I talk about myself, I was too much running in my professional life. I was little away from my family. I hardly used to get time to speak to my parents on call. You know, all the time working. And somewhere, when you are too much away from your family, from your peers, there is some sort of anxiety, depression, and a lot of other things that develop within that time, because somewhere you don't have that support from your family. So while I came back during Corona to my family, I'm spending more time with them, and I've somewhere felt that my the quality of life is getting better day by day. And now the whole perspective of myself, seeing the life has changed. And I think when I'll be back to normal, somewhere this gap is going to get filled, and I will always give more importance towards the family. And in a way, it is going to help me, in bettering my life.
Thank you. Do I take it that you are a frontline worker? You're involved in health, or?
Yes, sir. I work for the health ministry in one of the states of India on basically various issues, on the health issues. So, when you're there in ministry, there are a lot of challenges coming every day. So you don't actually get time, basically. But now that, that gap has filled and I'll be back to my work, that is definitely going to be shown in that, sir.
And let me just pause on behalf of everyone to just thank you for the excellent work you must have been doing as a part of the healthcare team. And we recognize the tremendous efforts that you all have made to make a difference during these different times. And thank you again for sharing.
Thank you, sir.
Anybody else would like to share with us?
I'm Ruto from Kenya. I'm adding 3. I'm trying also to share. Here we have a challenge because we don't have a mental facility. Yeah. So we're trying, they're facing challenges, being anxiety, panic, comfort zone, and also lost in addiction. We have a lot of dysfunction families. The kids end up straining in the way of life and end up in streets. So we're trying to at least do so, counseling them, doing mindset programs. Around, I'm from an organization, I formed an organization called Tiati Youth Development Association. Helping the government
interrupt, Ruto, but your microphone is really cutting off. I don't think we can understand what you're saying. You may want to maybe type in your question or your comment because it's really cutting off. Sorry about that.
But while he writes, some of the things that I heard, because yes, the connection wasn't the best of connection, but he did admit that they're trying to cope with challenges in Kenya and raise the issues in terms of families. And I got a sense that what he was saying is that they're looking at measures to work with families and to strengthen the response of families during these difficult times. But while we're trying to make a connection, I'll invite another person to join us. Feel free, encourage us all, because the more let's keep the conversation going. The more input we have, more energy and the more beneficial this conversation will be.
Okay, thank you so much. I'm Tobias from Kenya, and I'm glad to join you. Okay, from Kenya, being at home, it has brought a lot of changes in my entire life and my colleague youth, because most of the time we are spending with our parents. We are directed to do the work, the household chores that has led us to allow our minds be exposed in the work that we are doing it at home. Unlike when we were at school, at campus level, we get in touch with friends. Our colleague peers involve us into different programs that were seeing us indulging in using drugs that we are not using them currently at home. And that at campus level, when I was sitting alone in my room, I was experiencing a mental problems because one, when I miss a friend whom I've been having with last week, I get a problem. Two, as compared at home, when I'm with my parents after working in the shamba, that's in the garden, when I come back, we take tea or take something different, and that has made me to have more time sharing, talking about the life challenges, and to get the mental capabilities and stability improved. Finally, as I finish, again at school, both high school and university or colleges, I've had so many challenges that has made me to realize that COVID-19 indeed has done a lot. COVID-19 has improved our lifestyles. COVID-19 has made the youth to shun away from drug abuse. COVID-19 has made the youth inclusive to shun away from using illicit drugs, and that made me to form an organization, an NGO called CICAD, the Kenya Youth, the Kenya Youth Against Drugs and Substance Abuse. That initiative that had KYADI, Kenya Youth Against Drugs Initiative. It has brought many youth in my community and in my campus to realize that using drugs is wrong. Engaging in drug abuse will affect your mental stability. Engaging in drug abuse will lead you to indulge yourselves into sexual behaviors that will damage your future. And as I finish, I appeal to the youth in the entire world to realize that let us use this COVID-19 pandemic to do much that we would have missed doing at home, to do much that we would wish to do them in the future, so that we gain our desires and goals tomorrow. Thank you so much, and I'm really glad to be part of the team. Thank you. Tobias from Kenya.
Thank you very much for that enlightening moment of sharing with us. There's a question I want to ask you in terms of you say that you are in school, and then while you're on campus, there were moments that you were alone and so on. What has been some of the other experiences in terms of your friends and so on who have had to go through school closure and so on? Any major challenges you're seeing?
Pardon your question, I'm not getting it well. Pardon your question, Apid.
I'm sorry, no, the question is, now that
yes,
a lot of schools and universities have closed down, what are some of the challenges students like yourself have been experiencing?
Okay, challenge number one, we are experiencing a lot. One, at campus level, we were receiving cash, that's pocket money from our parents to use for personal effects. Currently at home, we are not receiving that cash, and that to some extent to other youth, my colleague youth who are now out of school now, they are affected in the sense that we are not well taken care of in terms of getting the upkeep that we are receiving while at school. Then two, referring to the question again you've asked initially, when I was at campus with my colleagues, taking myself in the foot of my colleagues at campus, when you are alone, you think a lot. You think a lot of things that come in line in your mind. But when you're back at home, you are restricted, you are restrained from moving from point A to point B because of the restriction, the rules by World Health Organization that are preventing us from moving from county to county or from country to country, either using a flight or a vehicle. So we are experiencing a lot of challenges, movement, social interaction with our colleagues. The only mode of communication, we are communicating with the friends or on phone, but keeping in touch is a challenge. Challenge number three, we are missing that rapport, that correlation with our other relatives, either distant relatives from other places because of restriction from moving. Then challenge number four, we are not exposed to other things. So I'm missing a lot as an individual with my colleague youth than I was alone at campus. So being restricted by parents is a very big challenge. That's what I'm experiencing in the foot of my colleague youth.
Yeah, thanks a lot.
Thank you.
Thanks a lot. And it's interesting because like your colleague from India, the both of you actually highlighted the positive in terms of being at home and with family. And interestingly, you spoke about spending more time in your shamba, which is your garden, having tea with your family members.
Yeah, maybe to
people.
add on.
Yes, go ahead.
To add on, yes, something else I would like to remind the young people. Today, COVID-19 has done something that even you as an individual, my dad, maybe to refer to you as my parents currently, with the youth, we have an opportunity. One, we can come up with an idea to revive our own economic structures by indulging in agricultural activities that will make us to forget, to shun away from drugs abuse. These economic activities, like even asking your parents to give you money, the little money that they would like to invest in you while at school, they can give us today. Then we invest in agriculture or other, even in the shop. Then we save the cash, we use them after our campus. But because of the youth, peer pressure, other activities that we indulge in, football activities, which are not there currently, we are losing a lot. We are really losing a lot. I appeal to the youth and to you parents. I challenge to you, doctor, that let us allow the youth to utilize this time by engaging them in other economic activities. Give them money and ask them what can they do with the money. That will help us to be able to be mentally free, so that we restrain ourselves from getting ill, mentally disturbed. Thank you so much, and I appreciate for your time and giving me a chance to be able to share my assertion. Thank you so much. May God bless you. Thank you.
And I thank you for your feedback. You probably realize I would have given you all a little bit more time to talk, because I'm interested in hearing from you, because I'm going to weave some of the comments that you would have made in my presentation. So if there's anybody else who has a burning concern or comment they would like to make, I'll allow you to do that as a last for this part of the webinar. Any other comment, any concern? Okay, I'll move on to my formal presentation. And clearly, in listening to you as a group, life has changed. A number of you have said that you're home with family, schools have closed. We didn't highlight any major financial problems. Certainly, there's chaos around. For some persons, they're involved in more caregiving. And for many persons, these can be very stressful times. And you know what is interesting? At the start of the pandemic, we had no playbook to guide us. We all had to devise coping strategies and mechanisms as we go along. And I must commend you as a group of young people, fine group of young persons, that you obviously have been developing different strategies to cope, and that you've been doing a lot of fantastic work in your community to build resilience and coping among your colleague young people. And so what I want to do today is to just build on that. And I'm going to share with you a few tips. Nothing new, coping mechanisms and techniques that you all know. And number one, the first one, I want us to remind us, accept your feelings. Name your emotions. Let me go back to, and in so doing, it's important that we learn to manage our emotions, that we name it, claim it, and tame it. And I want everybody, wherever you are, to just repeat this with me. Name it, claim it, and tame it. And in naming your feelings, I'm glad a number of you have actually shared up with us this today, the feelings that you have experienced. Feelings of anxiety, feelings of fear, uncertainty, right? And there may be other emotions that you may be having. And if you do, just write them down, scribble them down on a paper. But what is important is that we name our feelings and that we claim our feelings. And part of claiming your feelings is to recognize that your feelings are real. I would ask everybody to just repeat this for me as I go along. My feelings are real. They are what they are, and I have a right to feel this way. Because with the disruption in our lives, dislocation, stress, distress, impact on us as human beings. And the way we respond to stress is that we have different feelings. Be they anxiety, feelings of fear, feelings of uncertainty. It's important that we name our feelings. And as some of you shared with us that there were times when you were anxious, I just want to remind us that you're going to have days. You might have had days in the past, and today may not be a great day for you. And you may have bad days in the future. But just to remind you that it's okay not to be okay sometimes. That it's okay not to be okay sometimes. And I want us to all repeat that it's okay not to be okay sometimes. Excellent. So you name your feelings, claim your feelings, but it's also important for us to claim our feelings. And you know, unfortunately, a lot of young people actually tame their feelings by using substances or engage in problematic substance use. And this is what we want to discourage. And you know, there are many ways that people use to actually tame their feelings. And whatever works for you, you continue to work it. And there's one quick technique I want to share with us, which is the iMessage technique. And it's a way of
Dr. Abel, I'm sorry to interrupt, but the microphone is really cutting again.
It's cutting? How is it?
Like you speak and then sometimes the volume gets really low.
Okay, how is it now?
Now it's good.
Okay, all right, I'll have to stay closer to the source.
Sorry to interrupt.
Yeah, sure. So I'm sorry about that. So what I was saying is that there are many ways that we can use to actually tame our feelings, and you use whatever works for you. But I'm going to share a technique with us, which is the iMessage technique as young people. Very useful for us to use, because a lot of times we have our feelings and we don't have adequate tools to express these feelings. So for example, if you're feeling overwhelmed, instead of getting angry with somebody and hitting out, just express your feelings. And this is a useful technique. It starts by saying how you feel. I feel overwhelmed because I can't cope with being out of school. I can't cope with online classes. I can't cope with everything. And what I want is some help, please. I could spend the whole day going through this technique, but there are lots of examples online. So I'm going to encourage us to read up on this technique. It's an excellent technique to use personally and also to share with your colleagues. The iMessage technique. Number two, it's important that in these times we are positive. And I want everybody to repeat with me. After three, 1, 2, 3. These are difficult times. I can't be perfect at everything, and I'm doing my best. And I want you to believe it. And I hear some excellent work that you're all doing in terms of coping these days. In being positive, it's also important that we maintain a more positive view of things. it's important to note that COVID-19 may affect young people. The positive thing about it is that the majority of persons who actually get the disease will survive. And I just want to remind us that it's important to follow the public health measures, because these measures will reduce risk of spread of the disease. A major concern we've had listening to our young people has been about the news, that the news is too negative and it's distressing, it's confusing, it's scary at times, and it's hopeless. And I'm going to encourage us to filter the news. It's important to set limits on television. Lots of us, we're spending a lot of time online, on the internet. Filter the news. Manage your social media time, and even manage the time you spend in conversation, not to engage in too much negative news, but try to be positive and to focus on the positive things that are happening around. And I was very encouraged by you this morning, by you all, because you all chose to share with us a lot of the fantastic and positive things that you're doing in your community. Number 3, I want to remind us that my actions count. And I want everybody to repeat this with me, that my actions count. And it's important as we go through these difficult times for us to recognize that for all of us, our personal actions do in fact count. It's important that we pay attention to our hand washing hygiene, wearing of masks, paying attention to respiratory etiquette, avoiding close contact, and staying home if you're sick. Because as you know, and I recall when I was a younger person, life appeared almost invincible. That when we're talking about pandemics like COVID and health crisis, this is really for older persons and this will not affect younger persons. But just want to remind you that as young people, your actions do in fact count. And though it may not affect young people as severely in the numbers that it will affect adults, just to remind you again that young persons can be affected and young persons can spread COVID disease. And so it's very important for you to recognize your personal actions count and to encourage your colleagues to pay attention to their personal actions. It's about taking responsibility for ourselves and responsibility for our lives. An important coping mechanism as we go through these difficult times is to ensure that we maintain structure in our lives. It's good to establish routines, set structure for yourselves and your friends. And again, I have to, respond to what I hear some of you saying, that as you spend time at home, you're involved in the chores within the house, helping your parents, and no doubt getting involved in structuring your lives and getting yourselves more involved in the everyday routine. And this is good. And as a number of you have noted, by getting more involved in the family and getting your lives more structured, it reduces emotional distress and certainly decrease the risk of engaging in problematic drug use or drug use period. Number 4, self-care. Self-care is very important. And, they're the big 4 that we talk about a lot, ensuring that we have adequate sleep, we maintain physical activity. I don't remember who it was that shared with us that he started a program in his community to promote physical activity. And this is great, this is exciting. It's also important for you to pay attention to your diet and of course, manage everyday stress in more healthy and adaptive ways. And once again, it's good to hear coming from the young people, ways that you've been utilizing to manage everyday stress. And I just want to remind you that what works for you, great. If it works, and you work it if it works. Number 5, just to remind us that during these challenging times, support matters. And oh, I'm so encouraged to hear the outpouring from the group this morning in terms of the efforts that you have been making within your family and within your community to strengthen support, because that's been very important. And during these times, it's so important to keep in touch with your family, to keep in touch with your friends in and out of school, keep in touch with your parents. Some of us may have parents who may be out of country, family members out of country, or out of town. So important to keep in touch with our family members. And also to remember our teachers. I have been doing a lot of webinars, seminars over the past few weeks, and I'm surprised at the number of teachers who have voiced their concerns in terms of how stressful these times have been. And I'm just reminding us as young people to just reach out, keep in touch with everyone around, important people, and especially the elderly in your community who may not be able to be out and about during these times. And remember your friends, especially the vulnerable friends among us. Just keep in touch, and keeping in touch, maybe sending a text message, making a phone call, or whatever means of communication that you find most convenient, you know, but keep in touch. Using social media, whatever mechanisms you have, continue to keep to support each other. You know, these are exciting times as the world has shifted online, and there are lots of resources out there for young people. And I'm going to point to us some of the resources: UNICEF, the World Health Organization, Center for Disease Control. I didn't include the OAS, but they also have sites with great material on it. And of course, within each of us country, there's a lot of material put out by your local health education authority or various other agencies. But there's tremendous resources, and I encourage you to use these resources. Use them also to develop and strengthen your programs within your communities. Equally, there are also lots of resources out there for coping. And I have never ever seen as much or as many mental health apps available now. And there are lots of mental health apps online. Some of them are WhatsApp, Mood Kit, 24 hours a day. It's useful for working with persons with substance use problem. Quit That is another useful program for persons with substance use problem. Mood Shift for persons with depression. And we know depression can lead to substance abuse a lot. And there's eMood. But all you have to do is just go online and Google WhatsApp for mental health apps, and you'll see a lot of useful material, and you can choose and refuse from among them whatever you find appropriate and useful for yourselves and your community. And of course, there are also equally a lot of resources for learning out there. And you know, in closing, I just want to share with us from a little boy. It's really intended for his parents, but it's just a reminder, especially for the little ones in the community, the younger people among us, that we take care of them also during these difficult times. And this is what he said: if I were born with all my knowledge at birth, I would have said to my parents something like this: push, but do not shove. Talk, but do not scream. Teach, but do not lecture. Hold me, but do not pull me. Guide, but do not take my place. Lastly, love me without measure. And so my final word to you all is survive, please, as young people and as young leaders within your community. I need you to survive. We need you to survive, because the future of this world is in your hands, and we need you to survive to ensure that we have a safe, stress-free world and a happy world and a safe, drug-free world. So we need you all to survive. And with that, I just want to thank you all for participating and listening to me this morning, today.
Thank you very much, Dr. Abel, for your wonderful presentation. We have some time now for questions that you may want to ask to Dr. Abel. You can either type your questions in the comment box, or you can raise your hand and you can speak. So as you prefer. So as we wait for people to type in their questions, I can see some comments here coming in. From Back Magic, thanks so much for your valuable inputs. Betty Hunt, great presentation, Dr. Abel. Marie Bonnoir, thank you, Dr. Abel. I'm also going to read two comments that we have in the question box. The first one is from Raj Kumar. He's asking how to control substance abuse in third world countries like Pakistan. Dr. Dira from Pakistan, as we are already short of healthcare workers.
All right. Oh, and that's directed to me, because do we have a panel to other panelists?
So I'm going to also read another. I think we're having a little bit of trouble with the connection here. So I'm going to read another comments from Myrna Emanuel. Myrna is actually from St. Lucia, and she participated in the first Caribbean Youth Forum on Drug Use Prevention. And her comment is saying that COVID has made me an individual more grateful, in a sense that I am still able to work from home. Everything has changed, and I try to keep myself occupied by doing an online course. So COVID has allowed me to exercise and eat healthy. So thank you, Myrna, for sharing your comments and your positive experience with others. That might be an inspiration also for those who are thinking how they can fill out their time now that we are spending more time at home. I can also see here that we have someone who raised their hand. It's Rabi R. Rimar. Would you like to speak?
Hello. Can you hear me?
Yes.
Yes. Hi, everyone. This is Rabi Rahman from Pakistan. I really enjoyed listening to Dr. Abel. I'm very much blessed. I listened to him. So I have a very easy question from him. Like, he gave us hope. He gave us motivation. He told us many good things that we have to do right now, and we have to look at the bright future. I just want to ask, like I'm an activist, and I'm free these days because because of COVID, all the activism is almost zero, and we cannot arrange any events or go into any events. So my question is like, how can we indulge ourselves? What should we do in this time other than learning and gathering knowledge and having new skills? What should we do? Is there anything that he could recommend us for us to prepare for the future? Yeah, this is my question.
Can you hear me?
Yeah, I can hear Dr. Abel.
No, thanks for that question. And
Yeah.
whenever we have a forum with young people like yourselves, and they're talking, we learn so much, yes? And well, firstly, as some of your colleagues have said today, by being at home, number one, and bonding with family and participating in a lot of things that the family is actually doing, getting more involved in the household chores and so on. These are strategies that they have used to keep themselves occupied. Other young people have also said that they have used their time to just reach out to other members in the community, and they are doing work with the elderly, work with other young persons. I know this may be difficult sometimes, especially with physical distancing and so on, but reaching out and helping is certainly a great way to actually use our time and to help ourselves, because a lot of time it's in actually giving that we receive. But I know not everybody has access to reliable internet and so on. But again, there are so many things that can be done online, virtual meetings and conversations and activities and so on. But these are just some of the thoughts I'm having, but I'm sure your colleagues have some other ideas, and we welcome them to just share with us. But I just want to also respond to a comment that somebody made. I think it's Betty Hunt, who asked about how to deal with death and dying during these times. And it's a very important question. I did not deal with it in my presentation because I actually was hoping that somebody would raise it, because one of the challenges a lot of people have had during the COVID epidemic is that they're separated from family, especially older family members. They've had family members who are sick, family members who have died in country or also out of country, and they have not been able to go through the usual rites like the grieving rites, mourning rites, funeral rites. And so what has happened is that while we go through our grieving, and I think this is important to note that one of the most significant effect of the COVID is that we all have lost something, whether lost our structure in our daily routine. We've experienced losses in terms of school being closed and not being able to go to classes, not being able to go out to parties and events and so on. So we've experienced a lot of losses. And the way the human being responds to losses is that we grieve. And so many of us have really been grieving, including myself. There's so many losses I've had in terms of my usual routine, not being able to do certain things. Professor in the university, we've had to suspend classes. There are no students around on the campus, yes? And so there are days I go through my grieving process. And just to remind us that grieving is a normal and natural response to a loss, yes? And it's important to know that we all grieve at some point or another during this COVID crisis. And so the point I'm making is to Betty is that, yes, you may be going through some grieving process, and not only grieving, but you may have to suspend your grieving, especially if there's been a death in the family, and especially if that death has occurred out of country and you've not been able to have the funerals and put closure to the whole process. What you end up experiencing is suspended grieving. And just to let you know that with this, you're going to have feelings, different feelings, you know, sadness, depression, maybe anger times, and just to know that these feelings are just normal and natural. And I think it's an important point to just emphasize for us individually as we deal with these issues, but for us to also share with other young people and other members within our community. Is there any other comment?
I can see here that there is a comment from I can't really see his name, but he's saying many of us are suffering from mental distress that that for a long time living at home. Many people are worried about job and family income. Also, many of them suffering from sleeping problems. How can I help them in their mental health issues?
Okay. One of the most common mental health problem I find people are experiencing during this time is actually anxiety. And I think two persons mentioned that today. Firstly, it's worthwhile noting that it's understandable if we get anxious during these periods. Again, our feelings are what they are, and it's normal and natural to have feelings of anxiety. And when the anxiety is too much, it's overwhelming, it probably could prevent persons from sleeping. What a lot of people tell me is that they go to bed at nights and they're just thinking about a lot of things, thinking about death, thinking about dying, thinking about the disruption in their lives, thinking about family members not working. And what I've found, there are many techniques that we can use to manage anxiety. And I'm sure you have ideas also that you've used, whether it's listening to music, going out for a walk, talking to a friend. There are many techniques. I know young people are limited these days in terms of being able to engage in different types of sports, especially contact sports and so on. But whatever works, works. But there's a simple technique that I use for myself and I share with others, which is deep breathing exercise. And we'll probably pause. There are many variations of this technique, but I have a simple technique that you may want to apply to your personal lives, or you may want to share with your friends. And so I'll just go through it very quickly. Wherever you are, just ask you to sit and ask you probably to just hold on the arm of the chair and plant your sole of your feet on the floor or the ground, wherever you are. And what I want you to do is to breathe in gently through your nostril. And as you breathe in, just focus on the air going down into your lungs. And you pause a little, and then you breathe out through your mouth slowly. And as you breathe out, just focus on the air going out. Just want you to just repeat that technique in and out. In the interest of time, I'm not going to go through the whole exercise. And there are many versions of it online. But deep breathing exercise is a fantastic way to actually manage anxiety and to reduce high levels of anxiety that are associated with stress. I find it works wonderfully, especially if you're stressed out and anxious prior to going to bed and find that you have difficulty sleeping. It works if you work it. So I'm going to encourage you to go online, look at the various techniques that they have for deep breathing and practice it, share that with your friends.
Thank you so very much, Dr. Abel. It's already 12:20. I know that some more people have their hands raised, but unfortunately, we are running out of time. So you will receive a follow-up email once the session is completed, so you can email your questions and we'll forward them to Dr. Abel and he will try to respond. Yes, please go ahead.
If any of the young person wants a copy, they're welcome to have it and they can use it and build on it to be used within their community. You know, it's out there to be used. That's why we do presentations like this, to give you so that we can empower you. Thank you.
Thank you. Thank you very much, Dr. Abel.
Isa, you're on mute.
Sorry. So as we are, I'll just repeat what I said when I was speaking with the microphone off. I apologize for that. So as we are about to finish our presentation, our webinar today, I want to say thank you to Dr. Abel for this very interesting presentation and for all of the information that you shared here today. I'm sure everybody found it very useful. Unfortunately, we don't have much more time. So if you still have any questions, you will receive a follow-up email and you can share your comments, your feedback, or your questions. We'll follow them, we'll send them to Dr. Abel. So I would like to invite now Ms. Jimena Kalawski. She's the Demand Reduction Unit Chief of US-CICAD to deliver her closing remarks. Jimena, welcome, and thank you for joining us.
Thank you so much, Isabella. Thank you very much, Dr. Abel, for this excellent session, which was prepared with much love. I am sure that the leaders gathered here will take your reflections into account. Since the beginning of the pandemic, we in the Demand Reduction Unit have been concerned to supporting the member states in these difficult times. This is a good example of what are we doing about it. The impact on mental health as well as substance use is at the center of our concerns and worry. Dear young leaders, these have been difficult times for all of us. I am sure that with your energy, support, and above all your concern and care for your friends and loved ones, we will come out stronger from this pandemic. A big hug, congratulations. Thank you.
Thank you very much, Jimena. But just before we finish, I want to invite, we have here our dear friend, Dichen, Choden. I'm sure many of you know her, and I want to, she's really one of our main implementation partners for the Youth Forum project. So I want to invite her to talk to you as she's here with us today. Dichen, welcome.
Thank you, Isabella. Thank you, Dr. Abel. It was a really good webinar. I think I know most of the youth who have come from Asia, Africa, and the Caribbean. It's really good to see you all. I would also like to thank my boss, Dr. Nathalie Panabokke, for joining us, for being supportive, and also Isabella's boss, Jimena, for always joining us for the youth programs, and of course Isabella and Santiago for putting this together and then putting up a good webinar. And I look forward to more webinars. This has been a very good partnership between the Colombo Plan Drug Advisory Program and the OAS. And regarding mental health problem, I think Dr. Abel already covered that very well. And to all the youth who are present here today, we will be having more webinars in the future, so please do join us. Thank you so much.
Thank you very much, Dichen. So as we are about to finish this session, I just want to say thank you very much again for joining us here today. I truly hope that you enjoyed this session. And as Dichen said, we will be having other sessions for the youth. So we will be communicating all the information in the near future. So I hope that you stay well and that you stay healthy, and I hope to see you again soon. I think Dichen wants to say something before we finish.
I would like to thank Charlotte. I thought she had left, but I just saw her name. So thanks to Charlotte as well for always being supportive of our programs. Sorry, Isabella.
No, no worries. Yes, thank you. Thank you, Charlotte, INL, Colombo Plan, Dr. Abel, and UE for all your support. We could not have done it without you. So thank you. And I hope to see you guys again in the near future. Have a wonderful day.